You're listening to Thrombo Watch, the podcast that unpacks the realities of blood clots and stroke. In this episode, Louise is joined once again by Dr. Amman Sharma as they take a deeper look into her family history, the impact of genetic risk, and the story behind her grandmother's sudden stroke.
Hi everybody, thanks for joining us. I've got my good friend Dr. Amman Sharma with me again. If you watched the last episode, you will remember that he took me through the family history that I have and explained a bit around the genetics of that. I need to go a bit deeper this time. I need to know a bit more about my grandma's stroke, for example, and we'll come to my dad and maybe me later. But can you tell me, so my grandma, she was 53, she'd been to visit me, my mum put her on the bus to go home and she didn't make it. From no symptoms, everything was fine. She was a little bit tubby, for a tubby grandma. But other than that, she didn't really drink, she didn't smoke. She got on the bus and she didn't get off again. It was so traumatic for my family. Such a shock. I was the first grandchild. There were a couple of others on the way and she missed out on all of that. So what happened to her? She got on the bus fine. She didn't get off. It was a stroke. What's a stroke?
Sorry for the interruption here, people. We realised after recording this that this bit could probably do with a bit more explanation. So here goes. We know Louise's grandma is likely to have the same genetic condition as Louise's dad and Louise, Factor V Leiden. We don't know whether that would have caused her stroke. In fact, it's unlikely that it would, unless she had a hole in the heart as well. If she had a hole in the heart, then the clot could travel up from her calf, cross over through her heart, and then travel up to cause a stroke. If there's no hole in the heart, then from what we understand, there isn't really the potential for Factor V Leiden to cause the clot. So whatever the cause of Louise's grandma's stroke, it might have been that, or it could have been something else entirely. Unfortunately, we really will never know.
Firstly, sorry to hear that, Louise. So, ladies and gentlemen, we do hear many people around the globe have a symptom or a disease called stroke. So, what essentially happens is in the brain, there are many blood vessels. These blood vessels have a one simple job of giving the oxygen and the nutrition to the brain, because brain essentially is the most important organ in the body. Yes, people argue the heart is, but yes, brain and the heart are the most important organs. So what essentially happens is when the blood flowing through these blood vessels, the arteries that we call, right? So two things can go wrong that cause the stroke. The first one is called ischemic stroke. That means a clot is formed, it occludes the pathway of the blood vessel, and the brain cells do not get any blood, thereby causing death of the brain cells or neurons, as we call them. The other way of getting a stroke is a hemorrhagic stroke, where your blood pressures are all over the roof. You have a long standing blood pressure, or you may have aneurysms. Aneurysms are basically sac in the blood vessels, which have a thin membrane, the thin wall, and they can leak, they can rupture and cause massive accumulation of blood in the brain. Both these conditions are still stroke, as I said, ischemic or hemorrhagic, but they still have the same drastic effect on us as humans. Going back to your grandma's story, so she was fit and well, did not have much comorbidities, but something happened.
When you say comorbidities?
Good question. So we live in a world where we got so much of metabolic problems these days, isn't it? We've got diabetes, we've got high blood pressures. So when we talk about comorbidities, it's essentially you have multiple conditions at the same time. We live in a crazy world now, right? We've got so many metabolic conditions. We've got high cholesterols. We've got elevated blood sugars. We've got hypertension. We've got kidney problems. We've got hormonal problems. So when you have a complex condition where you've got multiple conditions at the very same time, we say what are the comorbidities risk of the patient.
Okay. So as far as we know, my grandma didn't have many.
Yeah.
And off she went on the bus to go home from visiting me,
Yeah.
the baby. So what would have happened to her?
So again, going retrospective, very difficult to comment upon, but yes, what if she had a genetic disorder which made her prone to clot formation?
And given that my dad did, it's possible that she did.
It's quite possible whether your grandmom also had a genetic disorder which got eventually passed on to your dad and got passed on to you. So the chances of having a genetic disorder in the family is quite high.
Okay. So she got on the bus. Would she have felt pain? What would she have experienced?
Good question. So when someone experiences a stroke, as I said, your blood is devoid from going into the brain tissues. So the different part of your brain respond to different functions, right? When you're speaking, it's somewhere else. When you're eating, it's somewhere else. When you're swallowing, it's somewhere else, right? So what happens is if you've got a massive clot or a massive bleed in your brain, it devoids that particular area to do its function. So now I'll give you a very simple yet tricky example. Most of the people write with their right hand. Which part of their brain is more active?
So I think I know this, and I think it's the opposite side. So I
Yes,
think it would be the left side. In that.
excellent. So our brain has two basic hemispheres, as we call. So you've got the right and the left brain. Yes, again, job distribution is there, but there's a crossing over of the nerve fibers. So, for instance, if someone is right hand dominated, their left brain is more dominated, and the goes the other way around. So, what happens is, for instance, now someone had a massive clot in their one of their arteries, which you call as middle cerebral artery. So, again, your brain has three basic big artery groups: the anterior, the middle, and the posterior arteries. Okay. Most common site is usually the middle side. Okay.
Okay.
So now you've got a massive clot in your middle cerebral artery. What happens is the areas which are working day and night to make you work go off suddenly. So it's like, in a simple way, if you may say, it's a power failure. Okay. And that responds in a way that suddenly you lose power on your right side. The bigger the area which is getting devoid, the more the symptoms. Many people have clots in very proximal, not proximal, very distant form of the blood vessels, as in they're going and supplying the superficial areas in your brain. So the symptoms would be a bit less. The more they involve the bigger blood vessels, the more symptomatic the person is. So, good question whether they feel pain. Most of the people do not feel any pain.
That's good to know.
But it's not good as well because you can see your hand lying on your bed and you can't lift it. Think about the implications one might be going through when they can see that their hand is there, they can't feel it, they can't move it, and it's not responding to them. I feel it is an absolute catastrophic feeling that one person would be going through.
Mm.
But unfortunately, that's what stroke does.
Okay. Would that clot, if let's assume it was a clot because my granddad didn't have any clotting issues. So the feeling is it wasn't my grandmother to my dad to me. So we assume that maybe she had a blood clot rather than a bleed. Would that clot have been, would it have emerged that morning? Would the clot have happened? Could it have happened over weeks, months?
Very good question.
And where did it come from?
Yeah. So basically, when we talk especially about our two organs, the heart and the brain, there is an aging process in the body which we call as atherosclerosis. Again, a bit very scientific, but for you to understand, your arteries, your blood vessels, they are aging as we are aging, isn't it? So what happens is because of the long time food habits such as smoking and drinking, again, genetic disposition and everything, what happens is there is an accumulation of fat inside the blood vessels. For instance, the normal diameter of the blood vessels keep on shrinking and shrinking. What happens is when you have this clot getting exposed and you get few components in the blood such as platelets, fibrins, and other proteins, they go and they start to aggregate there. Okay?
To gather,
To gather there, to stick there, because now it's an inflamed, sticky surface in the blood vessel. So everything is going and sticking there. So all the blood flow that's going, eventually the amount of blood that's going through is reducing because you've got a narrowing, but it's also causing viscosity, turbulence. So your blood is getting round and round. more and more platelets and fibrins are coming there, getting attached, and eventually something is born which we call as a blood clot. Okay. This blood clot is a combination of, as I said, so many components in your blood. It's not coming from anywhere else. It's there in your body. Okay. So predominantly the platelets, fibrins, the proteins, all of these entangle. And when we have seen the kids play with palm, have you seen that thingy? Right? It's soft, it's circular,
Yeah.
it's got rough edges coming out. Consider blood clot as a palm. Okay.
Bit like my microphone.
Yes, like exactly like this. So what happens is it's not going to be a very regular in shape. It might be there. So it just gets and clots until, there's a full stoppage of the blood going from that vessel. And that's where you have the stroke. That's where you have the heart attacks. These essentially, again, life-threatening conditions. If person does not know about the symptoms, they can potentially die. Unfortunately, as in your grandmom's case, right now it's difficult to say what exactly might would have happened. But if she suffered a massive stroke, which involves vital areas in your brain which control your breathing, your heart rate, your swallowing, this can be potentially life threatening, because now we are talking your grandmom about many years ago when we did not have this much of advancement in the
No.
medical sciences. So unfortunately, if she had a stroke and she suffered a massive stroke, rehabilitation and stuff was a very primitive and what is non-existent field then. And also whether they could have been given some medications to dissolve the clot. Now if someone suffers a stroke, for instance, Louise, if they have a clot in their brain, if they come to the hospital within few hours of the development of the symptoms, we can give them a medication to dissolve the clot. If that doesn't work, if they're certain beyond a certain time threshold, we can do a mechanical thrombectomy, which we pass some guide wires to the blood vessels and we go to the brain and we suck the clot out. But unfortunately, the brain, the heart, all of these vital cells, if they have suffered a problem, they will die.
Best look after them then.
Absolutely.
So I hear people talk about mini strokes.
Yeah.
What does a mini stroke, is that indicative that there could be a problem ahead? What might someone experience if they've got a mini stroke?
Very
For
good
help.
question. Again, the process remains the same. You might have a clot formation, okay, but the clot is quite small. Your body does try to push it forward by the amount of pressure generated from your heart, the blood pressure. So what happens is, because if it were a very fragile clot, which they usually are, it breaks. And the area which was getting devoid of the blood supply suddenly gets a bit more blood. So your symptoms, like for instance, someone had a facial drooping, slurring of speech, okay, weakness in your arms or your legs. It was there, but it's gone, suddenly gone. So if these symptoms have come and they've gone, it essentially people call it as a TIA or a transient ischemic attack. Of course, if you've got a TIA, you have to go to the hospital, get it seen by a stroke specialist, because this is the tip of the iceberg. There's further dangers which are there. So we would need to put you on some medications to avoid you getting a full blown stroke, which can be catastrophic.
So it's a warning.
Yes, it is a warning shot.
Okay, thank you. That really helps. You mentioned that bits of the clot can break off. And I know that was a danger with my dad when he was clotted from his groin to his ankle. The danger of a piece of the clot breaking off and traveling was something that we were warned about.
Yeah.
You're warned about it, but you can literally do nothing about it and you don't know if it's happening.
Yep.
So can you tell us a bit
Absolutely.
about that?
Great question again. We've got clots in the arteries, which are predominantly for your heart and your brain, resulting into a heart attack or a brain stroke. Similarly, we've got blood vessels, which we call as the veins, the ones you can see on your hand, the superficial blood vessels. What can happen is, because of any precipitating factor, like you've been dehydrated, your lifestyle is not great, you smoke, you drink, you don't exercise, you've got genetic predisposition, you're on hormonal medications, you just had a surgery and you're not mobilizing much. All of these can precipitate a clot formation in the veins. That's why we call it as deep vein thrombosis. So a clot in the veins of your legs usually is what you're talking about. And that's where it becomes a bit tricky. So this condition, which we call as a deep vein thrombosis or DVT, is quite common. People may get symptoms like swelling around your leg, pain around your leg, some discoloration around your leg. But DVT itself is a life-threatening condition. What here becomes more threatening is when you get a bigger and bigger clot because it's just accumulating. It can break off. When you say what means breaking off. So when I said blood clot, it's a soft, meshy thing, right? So what happens if it's become big and a part of it is just hanging by it because of the blood flow, it'll just tail off. So with it getting breaking off from the main clot body, what trouble can we have? It shouldn't be because it's small, isn't it? Thing that becomes tricky is if it travels from your leg to your lungs. That's where we call it as a pulmonary embolism. And that's amongst the most potential life threatening conditions ever. When we talk about cardiac arrest, pulmonary embolism is amongst the most precipitating factor for one to have a cardiac arrest as well.
It's really scary.
It is. It is. But again, preventable.
So if you've got a clot in your leg, you've got big blood clot in your leg, and maybe you're on blood thinners for it. Is there anything that you should do to limit the chances of a bit of it breaking off and traveling? And is there any way to know that has happened?
It's really tricky because if you've got a deep vein thrombosis, means the clot is there. The way we can prevent it further is, of course, you'll be put on a blood thinning medication, which we call as anticoagulants. You talk about warfarin. We'll talk about the warfarin and the other anticoagulants in our next podcast to come. But for now, you put on a blood thinning medication, but you have to take other precautions. You have to keep yourselves hydrated. You have to mobilize. You have to reduce the risk factors, specifically smoking. So if you're doing all of these things right, usually the blood clot does not progress. And that's where things look okay.
So activity.
Yeah.
In some ways, you'd think if you were active, you might risk it breaking off more.
Yeah.
But what you're saying is that if you're active, there is less chance that it'll break
So
off.
breaking off again is quite uncertain. We don't know if it's going to break off, not going to break off. That is why we put people who've got DVT on blood thinning medications. You might would have heard about various medications, low molecular weight, heparin, warfarin, apixaban, rivaroxaban, edoxaban. There's a big group of, as I said, we'll talk about that in the podcasts to come. But if you've already started someone on these medications, the risk for them developing these clots decreases significantly. And then, yes, of course, why am I talking about mobilizing? Because, okay, you've got the clot now. We've given you medications for it not to disintegrate or not become big. But how can we prevent it from further happening? The only way, lifestyle modifications. I'm not saying that if you've got a clot in your leg, you should go and run 10 miles, but you should keep yourself active on your feet to keep that blood flow running.
Thank you. All of the things that you said about staying healthy, not smoking, managing your high blood pressure, all of those sorts of things. I guess healthy eating comes into that.
Of course.
Getting your exercise. If people are doing those things, they are going to reduce the risk of this happening to them.
See, as I said, lifestyle modification helps in all aspects. It's just not the blood clot related problems. If you've got metabolic problems like diabetes, again, lifestyle modification, hypertension, lifestyle modification, depression, lifestyle modification. There's so many things that lifestyle, but yeah, what sort of lifestyle? Because you've got so many people advertising so much stuff on the social media these days. You don't know what's healthy for you and what's unhealthy for you. Simple way for you to understand is keep yourself hydrated. When we say hydrated, you don't need 5 liters of water a day. Depending on your body weight, the ideal should be between 1.5 to 2 liters. But again, if you've got heart failure, if you've got some other conditions, that water intake would reduce.
Okay.
So it's not like one size fits all. No, every individual is different. So that's just water intake. Okay. If we talk about people who've got kidney problems, their intake and their protein and calorie intake is going to be different. People who are diabetic would be entirely different. But if we say nutshell, common for everyone who's not having comorbidities, as we said, again, guys, don't do anything excessively. That's what I want to emphasize. If you're going to run a marathon, don't go and run the marathon in day one. Start and building the endurance, the physical, the endurance. So do some physical exercise. It's often said, all the scientific journals would say their own bit. But if you're doing a bit of vigorous physical exercise, few days a week, that's fine. I'm not saying jump off a cliff or go and conquer the mountains, but just very basics. Go out and walk, go out, have a chat with people, do some cycling, exercise, swimming, whatever your body and your conditions permit you. Because if you're working a 12-hour job, I don't expect for you to go and hit the gym and do all of this and claim, oh, I can't do this. Whatever you can, like maybe walk to your office, cycle to your office. Louis does cycling all the time. So these are the small things.
Yeah, I'm remembering my dad when he had his clots and he was on crutches because his legs weren't good for a number of reasons after he had the clots. And he would go around the neighborhood every afternoon. He was forced into the retirement. So he went out and he walked, but he also saw people and he chatted. That was good for him to get out. And it really did keep him healthy for a long time. So yeah, he definitely wasn't cycling or swimming or anything like that, but he was going for a walk around the neighborhood every single day.
To wrap up, I would like to say this. People who have stroke, they think they're not fit for purpose anymore because people can see their weakness. People can see their limbs not moving. What I would encourage you all is, it's a tough part. It's a tough part in life that you all are going through, but that should not stop you from talking to other people, going out and enjoying the nature. Secondly, people who've got heart attacks, there's a very good rehab program for people who have heart attacks. And of course, their heart is weak, but that won't show reflectively on them. So you've got more potential and you've got more liberty to go out and do whatever you want. People who've got DVT and P, again, it's not like you had it, your life is doomed. No, you had it. You can move on. You can prevent it. You can get it over with it. That's what I want to emphasize here.
That is a great message. Thank you.
This podcast is for informational purposes only and does not constitute medical, legal, or financial advice. The opinions expressed are the personal views of the Thrombo Watch team. If you think you may have developed a new blood clot, please speak to your healthcare provider urgently. Health-related information on this podcast, including text, graphics, images, and other material, is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or any other qualified healthcare provider with any questions you may have regarding a medical condition. If you believe you're experiencing a medical emergency, call 999 in the UK. For less urgent assistance, call 111.